is a connection between financial stress and health issues. We know that. Part of that is because understanding health literacy and financial literacy, the overlap is really in the skills to be able to learn and to be health literate and financial literate in today's society. So, for example, you have to be able to interpret documents. You have to be able to read and write. So that's print literacy. You need to understand and use quantitative information, which is numeracy. And then you have to be able to speak and listen effectively, which is oral literacy. But also, I would argue there's some dimension of being able to advocate for yourself.
Research indicates there are 4 factors that strongly predict happiness and well-being: health, economic stability, work or productive interests, and family relationships. As part of its Culture of Health initiative, K-State Research and Extension is looking to use behavior change strategies to improve both your health and personal finances. On today's Sound Living, the connections between health and wealth. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Modeled after Rutgers Cooperative Extension's Small Steps to Health and Wellness, K-State Research and Extension Family Resource Management Specialist Elizabeth Kish says that the common characteristics between health and financial issues make it possible for the same behavior change strategies to be used to improve a person's health or personal finances, or both.
Yes, this is kind of a new topic amongst my colleagues and I, that we really do feel there's a connection between health and wealth. And obviously there's a connection between, if you may not have the money for the out-of-pocket, you may not have the money for your medications, perhaps it's a real challenge to come up with the money for your insurance premium. So that's kind of an obvious connection, but we feel that there's some other connections as well.
Talk about the difference between health and financial wellness.
So health has been defined by the World Health Organization as a state of complete physical, mental, and social well-being. And it's not merely the absence of disease or infirmity. And so a lot of times we think about ill health when we're not feeling well, but we don't think about sort of this state of being well. And then when we think about financial well-being, it's when a person can fully meet their current and ongoing financial obligations, they can feel secure in their financial future and are able to make choices that allow them to enjoy life. And so we also think about when we're healthy, we're able to make choices that allow us to enjoy life. We are fully able to meet our obligations, whatever they are, toward work or family, community. Even in the definitions, there's a lot of overlap, but we tend to think of them separately. So then there's this concept of well-being and then wellness. And if we think about wellness coming from this health definition from the World Health Organization, this idea of physical, mental, and social well-being or wellness, there's 8 dimensions. And financial wellness can be one of those dimensions in most models. And the others are emotional, spiritual, intellectual, physical, environmental, organizational, and social. And sometimes those words are slightly different in different models, but in general, it's whole health.
One of the aspects I think that comes into play here then is stress. If you're able to have the insurance, if you're able to take care of yourself the way you want to, the stress is going to be lower. So there's also that impact that stress can cause to make you less healthy.
Right. So there is a connection between financial stress and health issues. We know that. Part of that is because understanding health literacy and financial literacy, the overlap is really in the skills to be able to learn and to be health literate and financial literate in today's society. So, for example, you have to be able to interpret documents. You have to be able to read and write. So that's print literacy. You need to understand and use quantitative information, which is numeracy. And then you have to be able to speak and listen effectively, which is oral literacy. But also, I would argue there's some dimension of being able to advocate for yourself and having the confidence to ask questions in the whole health area as well as in the financial area.
How can we do more education so that people understand the importance of being able to prioritize wellness as being something that really needs to be at the forefront?
And that's a great question. I think one of the ways to do that is just talk about health is not just illness. Health is this whole way that we live our lives and the way we approach our lives, where we don't put things in individual buckets. Like today I'm going to think about how much I weigh, or today I really got to do something about my debt. It's the decisions that you make. So for example, to put those two together, if you're going to do something about your weight and you're going to think about your debt, well, maybe you go out to eat a lot. And we know that when you eat out, often you eat more calories than you otherwise might. And sometimes we charge it. And so then we're putting food, a consumable, on a credit card. It's a lot about awareness. It's a lot about slightly shifting our mindset to think about, my goal might be to achieve overall wellness, right? Overall well-being through all stages of my life. And what are the different aspects or dimensions that contribute to that? And certainly most aspects of our lives have a monetary component. So there's just the straight, how much does something cost? What do I have to give up if I choose this option versus another option? And then there's the health aspect of, is it good for me? Or does it make me feel better? Those kind of things.
Well, we often talk about the need to have a budget, to have goals on the financial side. And I think what you're saying is we need to also have those same goals and same disciplines on the health side.
I think that's right. And there are really some strong parallels. For example, for those of us who participate in worksite wellness programs, it's really brought home to us every year when we go do our biometric screenings. And we find out, what the healthy ranges are. And if we're outside of a healthy range, then we might be offered activities or coaching to change our state, those values, as well as possibly, hopefully, change the behavior over the long run so that we can keep our indicators within healthy ranges. What is hard for many of us in this field is, rather than saying, finances is an add-on to health or health is an add-on, just to really, truly integrate them, understanding that the decisions we make in one dimension impact other dimensions as well.
How can Extension help with this then? How can we kind of bring that message home?
Right now, the biggest thing that we as Extension can do, especially K-State Research and Extension with our Grand Challenge of Health and the activities we're doing in communities about the culture of health, is to really start to bring awareness to this. Challenge people to, in their own lives, think about, where do you see these interactions, not only as an individual and family level, but also at a community level. Where do you see opportunities or systems that are in place that promote wellness across many dimensions, and where maybe are there some challenges where some changes might be made? And then definitely there is education to be done. Part of it comes, we sort of mentioned briefly about insurance. And so when we think about what the purpose of insurance is, the purpose of insurance is to manage risk. And risk is kind of in many cases unknown. We don't know what our risks are, so we have to make some decisions. But insurance is really one of the final steps in managing risk. I mean, first of all, we can avoid risk, so we don't even put ourselves in this situation. And that, when it comes to health insurance, and health is really about this wellness, right? If we develop wellness, we can avoid some risks. Another thing about risk is you're going to retain it. So you might choose to engage in some behaviors that maybe not the best for you, but you're going to retain that risk and you're going to be responsible for it on an individual level. Maybe that is smoking. At this point, we all know smoking's not so good for us. But if we choose to smoke, then we're retaining that risk rather than putting it onto someone else or putting it onto the community at large, the culture at large. Then we can control loss or reduce risk. That's in some ways what the seatbelt is for, right? Is that we know that there's a possibility when you're in an automobile that you might have an accident, but if we wear our seatbelts, we have airbags. Some of those features are in place so that if something happens, it can reduce the severity, perhaps, of something that might happen.
So a lot of this really does boil down to our decision-making, and some of it should probably start at a young age, and that may be why it's important to really have this conversation and this discussion, is so that we can get started early with making these wellness changes.
Sure. I mean, if children are raised with a certain mindset and this idea that there is a connection between all of these different dimensions of wellness and how one can impact another. When we talk about wellness, we talk about a wheel, there's an activity that you do in the center, and then there's a line from the center, like spokes on a wheel, like an old-fashioned wagon wheel. And the line is a scale. Closer in, you're less well, and further out to the outer edge, you're more well. For each dimension, you rate where you are, and then you connect your marks. If your wheel is kind of flat on one side or off balance, you sort of have a flat tire. And we all know what that's like. And so I really like this idea of a wellness wheel. And if you're a bit out of balance, you're sort of flat, right? You've got a flat tire is, I think, really powerful. The first time I did the wellness wheel activity, I was like, oh, wow, this is, it really stuck with me. So maybe that's why I'm really interested in this topic, because I do feel like we tend to focus only on particular areas without seeing how they all interact. And it's the interaction often that's the most important.
Well, this gives you an idea then of some areas that you can focus more heavily on.
Right. And then you see, for example, if you decide to lose weight and you start to lose weight, most of the time people say they have more energy, they maybe become more outgoing, so it has some spillover effects. So you get outside. If you, for example, when you get a dog, dog walkers are friendly. You don't always know the people's name that you run into, but you always ask, well, what's your dog's name? But there's that social aspect of getting out and about. It kind of all feeds into itself.
Well, the interesting thing here is the fact that this is an overall wellness that you're talking about, because it's not just, how much you weigh or things like that. There are other aspects to health that come into play here.
Definitely. Obviously, we have to have systems, and systems need boundaries in some ways. Like the healthcare system has some boundaries, and that's okay, because otherwise it would just could be everywhere. But when we think about our own wellness, then we can be more nuanced, perhaps. And for each dimension of wellness, there might be a system that we need to access. And so that's where some of these different types of literacies come in. But again, don't think of them as discrete skills. Think of them as skills that you can use in all of these domains. Understanding how to manipulate numbers or understanding how to read documents, those are skills that transfer across domains.
I know this is kind of in the initial stages. Is there an extension publication put together yet, or something that you're working on?
So we are certainly working on figuring this out and trying to, I think, advocate that people sort of shift their mindset from thinking about ill health versus health to a sort of a full-on wellness concept, which is not new. There's already a program called Small Steps to Health and Wealth that our colleagues, Rutgers Cooperative Extension, have developed. They have 25 strategies that you can do. And for each strategy, there's an example of a health behavior that you might attempt and a financial behavior that you can attempt. For example, the first one is track your current behavior. So in money management, we often talk about tracking your spending, right? So you know where you're at. It's your baseline. In the same with your physical activity, you could track your water, track how many calories you're eating. So that's an example of you can do both. We talked about the benchmarks, right? Compare yourself with the benchmarks. So with the biometric screening, we know what the health benchmarks are. For finances, we talk about, for example, maybe your credit score, also perhaps a benchmark for retirement savings. Sometimes benchmarks can be a little bit demotivating, especially when it comes to retirement savings, because most of us haven't saved enough, right? But at least you know where you're at. You've got a goal. Some other ones are think about converting your consumption into labor. And this is a favorite one of mine. For something that you want to buy, think about how many hours do you have to work in order to pay for that. A lot of these health ones actually have to do with food. For example, if you're going to eat a piece of cake, how many calories is that? And then how much exercise or work do you need to do if you do nothing else, and you're basically adding on calories to your daily recommended goal. So those are some examples of how they kind of go together and how you can think of them. Again, it's kind of parallel tracks, though. So if anyone has any ideas, please reach out, because I really want to see how we can integrate them and not just think of them as side by side.
That's K-State Research and Extension Family Resource Management Specialist Elizabeth Kish. More information on health and personal finances is available at county and district extension offices and on the extension website www.ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.